Fort Wayne Medical, Oncology, and Hematology are helping our area beat cancer for 40 years now, and we have Dr. Gonzalez and Nurse Boots here to share kind of what separates you guys from other places that treat cancer.
So the first thing I think most important is, we've been in the community for over 40 years now. We have especially one physician, Dr. Tom, who's been here for over 30 years. Okay, he has treated multiple generations from the grandparents, parents, and probably their kids. Okay, finally, is just the experience. Since we've been here, we know the community. Okay, and pretty much we've gone through the changes that's been happening in Fort Wayne. Second would be research. Okay, we're really research driven. Okay, even in the beginning, before all these new trials with immunotherapies, we already had research going on. Finally, our third would be OCM. Okay, so we are 2 out of the 200 practices in the U.S. that is involved in OCM. Actually, in Indiana, we're only one of 2 practices that's involved in OCM.
I'm going to pretend I don't know what OCM means.
So OCM is essentially oncology care model.
Okay.
It was done by the CMS or Medicare. Okay, and what's been happening is, I guess, with all the new therapies now, the cost of cancer care, as everyone knows it, has skyrocketed. Okay, and this is one of the trials that they're trying to do to try and essentially control cost. Okay, through quality. Okay. And essentially, we're supposed to be coordinating. So what we do, not only do we treat the cancer, but we're also coordinating the care with regards to the other medical problems. So most patients with cancer, they just don't have cancer. They have high blood pressure, they have heart problems, and essentially we have to make sure that they're still following up those other medical problems.
All right.
Okay. And we also have 6-day. Unlike any other practice, we're open 6 days a week. Okay, so we are probably one of the easiest practice to get into. Okay, we have extended hours. Okay, and so pretty much instead of going to the hospital, we could bring the patients into the office to take care of them, so that avoid unnecessary admissions. Finally, essentially we focus on centered care. We are not affiliated with any hospital. Okay, so essentially wherever the best care we think, we would send you to. So for example, sarcoma. Okay, there are a lot of trials. So essentially what we would do is we would send you to the best, excellent cancer excellence.
Right.
And then go from there.
Okay. So as a nurse, what is your role in all of this? You get to really more interact with the patients?
Exactly. So we have many different levels of nursing care that we provide. We have chemo certified nurses who are oncology certified nurses who administer the chemotherapy to the patients. We have nurse practitioners and physician assistants then who help patients to deal with the side effects when they're going through chemo. So we have chemo nurses that are on the phone every day of the week. We have nurse practitioners on call on the weekend, so that if a patient is having a problem outside of the office, they can contact us via phone. We're able to work through the side effects with them, call in prescriptions, and if they need to come in and be seen, they come into the clinic and we help manage those side effects in the office then.
So in many ways, you're the touch point. You're the, the person that I get to know best.
Sometimes, yes.
Yeah. And that's got to be rewarding, I would think.
Oh, it definitely is. There are patients that we see sometimes every single week for a full year, getting them through their treatment. And so you learn a lot about the patient, their families. There are patients who are having children or grandchildren while they're coming to the office, and we get to know their entire families. And so our goal is to not just take care of the patient, but take care of their families and their support system that are helping them also get through their treatments. So
again, is somebody going to find you by, like, the patient comes to you, or is my doctor going to?
It's usually a referral.
Okay.
Okay. It depends. Depends on where the patient's initially seen. It could be we can initially see them in the hospital. So for example, they get admitted for something, and during a workup they find malignancy, or it's just as easy as the primary care seeing the patient, and in their workup they see something abnormal, and then they send it to us.
All right. Well, either way, I think it would behoove you to ask for these guys by name. See the information there on the screen about their locations north and south. There's more than that. Check out their webpage. We'll be right back on Insight.